morning, ladies and gentlemen. We are back from the Watany Ophthalmology Summit, and it gives us great pleasure today to have Professor Dr. Fathy Fawzi with us. Professor Fathy is a professor of ophthalmology in the Military Medical Academy. He's also an anterior segment reconstruction consultant, refractive surgery consultant at the Watany Eye Hospital. Very well known to be the CEO and co-founder of our hospital. It gives us great pleasure to have you today.
Thank you, Dina. Nice to be with you.
And so with this much long and successful career in medicine, tell us, how do you define a doctor as being a successful one?
Oh, thank you for calling me successful, and I evaluate this opinion. And in my opinion, the doctor, to be a successful professional, has to fill or to close the triangle. So as any triangle, it has three limbs. The first limb of the triangle we all know about is the skills of being a doctor. And everyone is keen on this. And most of the doctors we know are very skillful, and they are very keen about this point. But when we come to the second limb is the knowledge. Because many of the doctors think that skills are enough. If you, for example, you know how to remove a gallbladder from a tiny incision, and you can do it in 10 minutes, then you are skilled. But I'm sure there are reasons which you should not do this surgery, because the abdominal pains with this patient may be coming from another reason that you have to think about and read about, hearing conferences, follow up the recent papers. So to have proper knowledge is the backbone of the skills. And the third limb of the triangle is to be keen on the patient and to be honest with the patient. This is the social side of our profession. In our profession, everybody wants to earn money out of his profession. This is how he brings his family. But actually, in our profession, we don't earn per patient. In many professions, if you are selling goods, you are earning per each item of the goods you are selling. But actually, we don't earn per patient. Sometimes we have a patient coming to us to have surgery, and he's ready with the financial side and very keen on the surgery. And you say, sir, no, I will not do the surgery for you because it doesn't suit you. It will cause harm for you. This does not mean you have lost a patient and lost an income, but you actually gained trust of the family because you're doing what's good for the patient. That's how we gain satisfied customers. In our profession, a satisfied customer does not always mean that the one who had a successful surgery, but he had a comprehensive, honest service.
That's very interesting what you said, because a lot of the younger doctors right now, they're torn between so much to do, studying and practice. So what are your advice for these aspiring talents in order to manage their time and manage their practice?
Well, first advice, don't rush. Because in our profession, it takes time. That's what I wouldn't call it bad, but what I would call it natural about our profession. You are not a singer that you can be very popular in few days. But to be popular and successful, it takes time. Okay. If you don't accept that the fact you will take time before being popular and successful, then you will be frustrated. Okay. It takes time for the patient to tell another patient that he had service with you and he was satisfied. And always I concentrate on the word satisfied. Does not mean a successful surgery. It means a comprehensive, honest service. In all professions, when you have an unsatisfied patient, actually he will affect 12 of your customers that will leave you. So the effect of the unsatisfied customer is 4 times the effect of the satisfied customer. So a satisfied customer will bring you 3 patients over 1 year, but an unsatisfied patient will convince 12 patients not to go to you just in 1 year. So at least you have to have a result which is 4 times satisfied in relation to unsatisfied. That's 80% result or more. If you get an 80% satisfaction to the patient, then you can stay still. You don't excel.
That's very true.
But if you actually have a higher than 80% rate of satisfaction, then you can excel in your career.
So, given the day and age, it's a faster age, and with the emergence of social media, how would you change this? How would you say social media changed marketing, word of mouth? How would you say social media affected practice?
Actually, in our generation, we did not have the social media in the beginning, and still the patients would talk to each other mouth to mouth. And this was actually what was sort of a stable reputation.
Yes.
The social media are effective, we must admit this, but it's a double-edged weapon, and we should know how to use it. Because I see many doctors who go into social media and say, well, look, I am the best surgeon who does this and this. If I'm a patient and looking for a doctor and see the doctor himself talking about himself and saying I'm the best one to do this, sorry, I will not believe you. But if I hear someone else talking about you, that he had the service with you, or one of his relatives had the service with you and he's very satisfied, and he wanted to show his satisfaction and talked about you on the social media, then I will believe and will go to see you, because some other patient has tried the service and was satisfied. So the social media is good if others are talking about you. It's not good if you talk about yourself. This is very crucial, and I see, unfortunately, the doctors would use it to talk about themselves, and really he wouldn't know that it's repelling to his customers. The second thing which is good about the social media, you can use it for the public education. And in our profession, the people should know about diabetic changes that would happen at the back of your eye. Because this actually, the patient would realize that they had advanced diabetic changes at the back of his eye when it's too late to be treated. Should educate the public that they should get their kids tested. I know this is the responsibility of the school as well, but also the responsibility of parents. We should educate patients. We should get their kids to know if they are seeing well with both eyes or not. Sometimes the child can see very well only with one eye, and the other eye is lazy. And sometimes we discover at the age of 20 when he's applying for the military college, for example, or applying for a job. And he spent 20 years without knowing that he has a bad eye, because we don't get the kids tested in the proper time. So we should educate the public about this, about glaucoma, because glaucoma is a silent thief to the sight. So we should educate the patients that everywhere all over the world to get their intraocular pressure measured at least once a year. So this is a good use of the social media, rather than going there and saying, look, I'm very good, I'm excellent. I will not believe you.
That's I would recap what you're saying in that social media gives us a chance as medical professionals to go to the patient in their houses and educate them, rather than them coming to our clinics and spending time. So it is a medium for us to reach out for education better than word of mouth.
This is a very strong tool if used properly, and it has a marketing value.
It does.
If you are sitting there teaching them, you are not talking about yourself.
Yes.
They will love you and they will trust you. And this is what's nice and passionate about our job. We should love the patients. Actually, we should care about them. We should treat them like ourselves. I will not say treat this patient as your father or as your son. No, treat him as yourself. If when you are sitting there and taking a decision for the patient, say to yourself, if I am the patient, what I would have preferred to be done. So if you think that the surgery is good for yourself, then offer it to the patient. If you think it's harmful for the patient, don't touch him. You have to care for this patient. This is how you build your reputation. This is how you build a big tree that will give you lots of dates.
Thank you very much for your time and for your priceless advice. And that concludes our interview, ladies and gentlemen.
Thank you, Dina, very much for having me.
Thank you.